When the Republican-dominated Idaho legislature wouldn't expand Medicaid, the voters overruled them at the polls. Now, despite Republican attempts to limit the scope of expansion, Governor Little is providing some details as to how Medicaid expansion will be funded. 6 on your side's Madeline White joins us in studio with more.
That's right, Don. The Gem State will receive $400 million in federal funds to help pay for expanded Medicaid. As expected, state taxpayers will pay a share of roughly $41 million. But after Governor Little's State of the State address today, how the state will pay for that became a little bit clearer.
My budget implements a full-year Medicaid expansion with a net zero impact on the general fund.
Governor Little's proposed budget includes paying $41 million for Medicaid expansion. In his address, he said $12.5 million would come from the Millennium Fund, originally dedicated to preventing underage tobacco use, and $8.5 million from Idaho County's Indigent Fund savings, originally dedicated to covering Idahoans in need who can't pay their medical bills. The rest, he says, will come from a mix of other savings.
We've identified offsets in the budgets of the Idaho Department of Health and Welfare, the Department of Correction, the courts, the Catastrophic Health Care Fund.
He did not, however, say specifically how counties would be assessed for the cost. Still, this advocate who led a celebration for Medicaid expansion today says she's pleased with the governor's approval of Medicaid expansion on his budget.
That's wonderful. We fully support the governor's recommendation.
Perhaps even more directly affected by this news is 49-year-old Anita Sakovich, a single mother of 2 disabled children in Boise. She says she's lived the past 6 years without insurance in her $13 per hour job at a senior care facility. Anita recently had to have an emergency hysterectomy after sudden and severe bleeding one night.
I was really super scared of not being around for my children and to help others.
And she says it left her with more than $19,000 in medical debt. Without that surgery, she says,
I would have died. I would have died.
While she still has a long string of debt to pay off, Anita is one of the 53,000 Idahoans who has signed up for Medicaid now that it's expanded.
Feeling of it was done and I know that I'm going to have coverage was the best. It's going to allow me to be here even longer to care for those that I love.
And Dawn, as it stands now, it's estimated that 91,000 people are newly eligible for Medicaid, but it's still not a sure thing that all of those people will get to keep that benefit, though, because some lawmakers want to lessen the scope for Medicaid eligibility.
So talk about the waivers for a second. There was recently a handful of waivers introduced by the legislature, correct?
Yes, that's correct, including adding work requirements, limiting availability for family planning, and letting people who might receive coverage elsewhere opt out for a tax credit instead. But these are TBD, so I'll keep you updated. And keep in mind, if you're eligible right now to get Medicaid, the Department of Health and Welfare is currently accepting applications and will be throughout the year.
All right, thanks, Madeline.
Thank you.